Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srimati Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist I have provided almost all the topics in a very systematic order, and this is quite convenient for the study. My dear friends, we have been discussing about the clotting and bleeding time and bleeding disorders, and in the last class we have seen some of the interpretation related to coagulation profile, and we have discussed in detail about not detailed, superficial about intrinsic and extrinsic pathway. Now today we shall see the coagulation screen, and after completion of the coagulation screen we will have detailed explanation of intrinsic and extrinsic pathway, because it is better to understand after this. Now what do you mean by coagulation screen? Coagulation screen is used as an initial screening test in children who have the suspected bleeding or clotting disorders. Okay, or any cases, the coagulation screen is also done in any cases before the surgery, because surgery involves a lot of bleeding, and those who are in anticoagulant drugs, usually often coagulation screen will be done those who are taking anticoagulant medications, and in certain disorders like liver disorders or thyroid disorders, etc. Now, how to take this? Yes, the sample bottle is selected. Usually, the sample bottle which is used for the coagulation screen is a blue bottle. Okay, blue bottle which contains the citrate. Okay, actually, blue light is a little more resistant to the sunlight also, and so sunlight will not affect or sunlight may not mediate the clotting factors. So sample is blue in color, sample bottle is blue in color, and it contains a anticoagulant which is called as citrate. Okay, sodium citrate. So citrate will take the calcium out of the blood. This citrate will take the calcium out of the blood and prevent it from the clotting, because clotting factor activation is only possible in the presence of the calcium. Now when you add the citrate, what happens? It will going to neutralize the calcium, and there is no more calcium is available, therefore blood remain in the fluid state, it will not undergo coagulation. Very simple. In the coagulation profile, the first one is prothrombin time. Prothrombin, PT, it's called as prothrombin time. Now, extrinsic pathway, when we understand the extrinsic pathway, as soon as the injury takes place, factor number 7 is activated. Factor number 7 directly activates the factor number 10. And from the factor number 10, there is thromboplastin, then fibrinogen, then fibrin, and then plug. Okay, so now in the coagulation profile, the first one is prothrombin time. So, prothrombin time is a best indicator of extrinsic pathway. That means increased prothrombin time or decreased prothrombin time directly give an idea of the status of extrinsic pathway or problems related to extrinsic pathway. Okay, prothrombin time. So PT. PT means, you can remember, play tennis. Play tennis means tennis will be always played outside the home. So this PT is very good indicator for extrinsic pathway. If the prothrombin is increased, that suggests that there is some problem related to extrinsic pathway. Factor number 7, factor number 10, then formation of the prothrombin, fibrinogen, etc. So it is the best one for the estimation of the extrinsic pathways. Extrinsic pathway stops with the factor number 7, and rest is the combined pathway. We know that 10th is a common factor. Intrinsic factor also come and meet at factor number 10. Extrinsic pathway also come and meet at factor number 10. Okay, so if you want to have this picture, it will be little clear. See, in this picture it is told that after the injury, the extrinsic, this is the extrinsic pathway. In the extrinsic pathway, injury takes place, factor number 7 is activated, it will going to activate factor number 10. So this factor number 10 now will go and convert the prothrombin into thrombin. So presence of the prothrombin, if the normal prothrombin is present, that suggests that extrinsic pathway is right. If the prothrombin production is more, that means that extrinsic pathway is overworking. And if the prothrombin formation is less, that suggests that extrinsic pathway is underworking. Okay, therefore, for us, prothrombin, PT, play tennis, extrinsic pathway. Okay, so similarly, you go for the intrinsic pathway. Okay. Now, before going to the intrinsic pathway, we shall see where these extrinsic pathways get affected. Okay, since the isolated clotting factor deficiency is very rare, most of the time PT is raised due to generalized deficiency of the clotting factors. This PT can be raised in certain conditions or disturbed in certain conditions like liver disorders, vitamin K deficiency, warfarin use, and disseminated intravascular coagulation. Okay, so these are some of the conditions where PT, prothrombin time, is get raised. Prothrombin time is get raised. Okay, platelets, PT is get raised. Commonly due to in liver problems, maybe vitamin K deficiency, because vitamin K is very important for the formation of the liver dependent clotting factors. Okay, similarly warfarin use, DAC, etc. So this suggests that prothrombin time is get in all these conditions prothrombin time is get raised. That is prothrombin time is get raised. Normal prothrombin is not there. Now PT is decreased, prothrombin time is decreased than the normal. Okay, so PT is decreased than the normal. This is due to the conditions like pregnancy. This is possible in case of the pregnancy, estrogen containing medications, and also some of the thyroid disorders and use of the contraceptives, etc. What is the normal value of the prothrombin time? Now prothrombin or prothrombin time, that is international normalization ratio is around 0.8 to 1.1 for prothrombin time. So how international normalization ratio is done? This is calculated very simple by using patient's thrombophlebitis time divided by the control prothrombin time. That's all. We have got a control prothrombin time and we put the patient blood there. We shall see the patient's prothrombin time. And then we will give the result. So this is all about extrinsic pathway. Talking about the intrinsic pathway, how to identify the intrinsic pathway? What is the best investigation for the identification of the intrinsic pathway? So this is APTT. APTT means activated partial thromboplastin time. Activated partial thromboplastin time. So in this we have a TT. TT means table tennis. Table tennis is always played inside the room. Tennis is played outside the room. Table tennis is played inside the room. Therefore, we can say that TT, APTT, wherever there is in investigation where TT is there, APTT, TT is there. So it suggests that it's an intrinsic pathway. TT is played inside the room, just for remembrance purpose. So this is a good indicator of intrinsic pathway. Normal value of the APTT is 25 to 35 seconds. 25 to 35 seconds. It has to be produced. That means if APTT is normal, then the clotting will take place. The APTT time will be around 25 to 35. Intrinsic pathway includes, yes, it starts from factor number, intrinsic pathway starting from the factor number 12. Then it comes factor number 11, then 10, then 9, then 8, like that. Okay. So if you see the hemophilias, true hemophilias, that is hemophilia A, hemophilia B, hemophilia C, they are all because of the factors like factor number 7, factor number 8, factor number 9, isn't it? Factor number 11, etc. So in almost all the types of hemophilias, maybe A, B, C, any types, you will have altered APTT time, activated partial thromboplastin time. Even in case of deficiency of von Willebrand factors also, okay, deficiency of von Willebrand factor also, you will have intrinsic pathway get affected. Okay, intrinsic pathway. So APTT is for intrinsic pathway and prothrombin time PT, that is thrombin time for extrinsic pathway. Okay, prothrombin time for the extrinsic pathway. Now, if you see intrinsic pathway, that is activated prothrombin time, so that will decrease in some of the conditions like diabetes mellitus, thyroid disorders, thromboembolic phenomena, etc. Okay, so this is all about coagulation screen, basic coagulation screen, and this is nothing but coagulation cascade. Already we know that there are two pathways, intrinsic and extrinsic pathway. What we are trying to explain, I have given in the format, extrinsic pathway, and this is a picture if you want. See, activated prothrombin time here. Factor number, if you look into the intrinsic pathway, factor number 9 will be converted into factor number 10. That means factor number 9 activate होके 10 में convert होने के लिए, so we need calcium. This calcium is also called as factor number 4. So in the absence of this, there is no formation of this conversion of this factor number 9 into 10, and there is no conversion of prothrombin into thrombin. Okay, therefore whole process of coagulation will go into block here. Okay, so similarly factor number 8, this is the 8, and here factor number 8 stabilizing factor is there, that is called as a von Willebrand's factor. Okay, so the factor number 12, 11, 8, 9 deficiency will go to cause different types of hemophilias. This is intrinsic pathway, and this is extrinsic pathway. Factor number 7 is directly converted into 10. Once it is converted into number 10, so then it is converted to number 5. Number 5 is nothing but thrombin converted. It is fibrinogen into fibrin, and factor number 12 is nothing but 12, and factor number 1 is nothing but fibrin. Factor number 1 is nothing but fibrin. Okay, so once the fibrin is formed, it needs to get further stabilized. For that we will have factor number 13. So factor number 13 is a stabilizing factor. Factor number 1 stabilizing factor. Okay, so this is whole takes place. Ultimately, the process is this, factor number 10. Okay, so in the intrinsic pathway, the presence of the calcium that converts the factor number 9 into factor number 10, and in the extrinsic pathway, factor number 7 get activated to form the factor number 10. So factor number 10 converts the prothrombin into thrombin. Okay, so factor number 10, if you look into the coagulation factor, what is factor number 10? If you see in the table, factor number 10 is nothing but a Stuart power factor. Okay, so once this is formed, so then the process of coagulation start. How? That is convert factor number 10, it converts the prothrombin into thrombin, and further thrombin is converted into fibrin. Thrombin converts factor number 5 into fibrin, that is, it converts the thrombin is formed. Once the thrombin is formed, fibrinogen is converted into fibrin, and then the fibrin is stabilized by factor number 13. So formation of the prothrombin is a very, very important part. So formation of the prothrombin is affected maybe in the problems of the intrinsic pathway or maybe in the problems of the extrinsic pathway. Suppose if you see intrinsic pathway is totally out of order, it is not at all forming the thrombin, the extrinsic pathway is forming. But the amount will not be much more. Okay, so at the end, the clot which is formed will be weaker one. Similarly, if the intrinsic pathway is working well, extrinsic is not working well, still the coagulation will go to take place. Okay, but the strength of the plug which is formed, hemostatic plug, will not be up to the mark. If you take the examples of hemophilias, in the hemophilias, intrinsic pathway is totally get affected. Okay, but extrinsic pathway is working. So in hemophilia patient, there will not be any profuse bleeding. Okay, internal hemorrhages will be there, delayed bleeding will be there. Okay, like in hemoarthrosis, etc., hematoma, etc. But there is no any profuse bleeding, intrinsic factor नहीं है बोल के बहुत ज़्यादा profuse bleeding नहीं हो रहा है, क्योंकि extrinsic pathway से भी जो है आपको prothrombin बन रहा है, ठीक है, वो उसको adjust करेगा, but not up to the mark. Similarly, in the extrinsic pathway also. Okay, so this is how we have to understand the coagulation pathway. Very simple. In the coagulation pathway, we should note intrinsic pathway. If it is get affected, it is APTT which is get raised. If extrinsic pathway is get affected, it is PT, plate tennis, that is prothrombin is get affected. Okay, and intrinsic pathway is most commonly get affected in case of hemophilias, whereas extrinsic pathways get affected in thyroid disorders, diabetes mellitus, etc., many anticoagulant therapy, etc., many conditions. So details of this bleeding and clotting problems we shall see from the next class onwards. That is approach clinical approach, identification and disorders. So that we will see in the next class. Thank you very much.